crisis revealed our vulnerability as a country, from a breakdown in PPE supply to limited testing and vaccine availability. But some hospitals still report one of the most disturbing issues is a critical shortage of essential medicines for children. And joining us to share why some of the top children's hospitals are teaming up with pharmaceutical manufacturing company Flo to look for answers are Dr. Kurt Newman and Dr. Eric Edwards. Welcome.
Thank you.
Morning.
Now, what is the potential impact of this type of essential medicine shortage in children's hospitals?
Well, this is a problem that pre-existed the pandemic, but it's only made it worse. I was a surgeon before I was a CEO, and it was not uncommon every month for our pharmacy director to come and talk to us and say, here's the list of drugs that we may not have if we don't do something next month. Now, we'd always find a way, but it was a scramble. We'd have to find maybe a new supplier, maybe pay more money, maybe use an adult medication and figure it out for children. And that's just no way to be when you're taking care of kids. You want to have that certainty to know that those drugs will be available when you need them. And that's got even worse during the pandemic. And that list has gotten longer. And I know that as a CEO. So what we're doing today is bringing some of the top children's hospitals together across the country. It's a beginning to create a coalition to work with a company, Flo, so that we can solve that problem, that these drugs can be manufactured, that we will know that they're good, that they're available, that they're safe, and that they'll be there in a certain way for our doctors, nurses, for the kids, and the children's hospitals across the country.
Dr. Edwards, talk to us about the coalition's plan to battle medicine shortages.
So the coalition is all about providing certainty and availability, certainty and quality, and certainty and affordability. And we're going to be manufacturing these as a public benefit corporation end to end. Our vision is to make sure that every human being, including children, has access to the most essential medicines necessary to sustain life and conquer disease. And we're focusing on manufacturing all of that right here at home with American jobs, American infrastructure.
Now, how has COVID-19 played a role with respect to this drug shortage?
So COVID-19 played a role in exposing the vulnerability of supply chains across PPE, as you mentioned earlier in your lead-in, and ventilators, devices, diagnostics, but it also impacted our key essential medicines. And in particular, Laura, the active pharmaceutical ingredients, these ingredients are primarily made outside the United States in countries such as China and India. And so what we're trying to do is say, listen, we believe in a global supply chain, but for our most critical essential medicines, we should have access to that manufacturing right here in the United States. We're going to be reshoring that infrastructure and making these medicines so that no hospital ever has to wonder, will they have these key critical essential medicines when needed?
Dr. Newman, do you expect other children's hospitals to join this existing coalition?
Absolutely, Laura. This is just a start. That's why it's a coalition. We want everybody in. And that's why children'shospitalcoalition.org. I want all my colleagues across the country to have the same opportunity to solve this problem for their patients, just like we're doing.
And to learn more, you can visit the website listed on your screen. Dr. Newman and Dr. Edwards, we thank you so much for this valuable information.
Thank you.
And we thank you for joining us in San Diego Living. We'll see you next time.